All right, guys, bring it in. Today, we're going to talk about high blood pressure and the true cause of high blood pressure, which now, from this point on, I'm going to call hypertension. So, defined as essential hypertension, basically, it's high blood pressure of unknown cause. Now, the medical community for the last 50, 60 years, they've attributed high blood pressure to genetics, family history, obesity. Obesity is a popular one. High salt intake or inactivity, age. As you get older, you just get hypertension, alcohol, tobacco use, diabetes, stress, poor sleep, high caffeine, or my favorite, and especially with the medical professionals, is it's multifactorial. So I believe it is none of these things. And what I'm going to talk to you about is the true cause of hypertension. This is a hypothesis, but it's called GCN, glycated cellular necrosis. Hi, my name is Calvin Hageman. I've been in pharmaceutical sales for over 20 years. So I've been around drugs and therapies and treatments for many of the metabolic diseases that we suffer from today. But I've also been highly focused on trying to find the true causes behind these chronic diseases. And for over 20 years, I've been obsessed with what is the true cause of chronic disease. And what I found and discovered is that what we've been told for all these years, absolutely not true, but it's very simple. And once you understand it, life becomes simple. So stick with me. All right. So I love this because we're talking about hypertension and high blood pressure. Hypertension, to me, it is the keystone of chronic disease. And then nobody knows what causes hypertension. It's essential hypertension, which means, well, we don't know. But I'll tell you, it's a big problem. 47, almost 50% of American adults today have hypertension. 15% of children between the ages of 12 and 18 have high blood pressure. Now, when I'm talking about like elevated blood pressure. There's 4 different phases. I'm going to put this up on the screen, but it's normal, elevated, stage 1 and stage 2, depending on your blood pressure. But normal blood pressure should be 120/80 or lower. And if you're not, then you're in the elevated stage or stage 1, stage 2, depending on the level. And that means you've got significant disease going on. But I want you to undergo a paradigm shift in your thinking here, okay? The medical community and most Americans, we think of hypertension as a disease, and you're given medicine, it gets treated, and then move on to the next thing. I want you to think about it differently. I want you to think of hypertension as a symptom of a much greater disease that's ongoing. And if we have that kind of mindset, I think it's going to help us overall get to better health. All right. So what's the mechanism of action of hypertension? How does high blood pressure even show up? How does it occur? So I want you to think of the heart and arteries as one organ rather than separate things. It's called the cardiovascular system, so I guess it's all put together. But if you think of the heart as just the organ itself, also think about the arteries coming off of it, going all the way down the legs, up into the brain, down into the arms, to the kidneys, and so forth, and to all the organs. I want you to think of it that way because it all works together. In a normal, healthy heart and cardiovascular system, as the heart beats, the bolus of blood during that one heartbeat, which is the systolic reading, it travels down the artery swells or bulges, and it helps propel the blood downstream. And it's given that artery a larger diameter, so there's less resistance as it dilates and then quickly comes back down to its regular size. So there's elasticity in that artery. Okay. So as somebody eats a standard American diet, which is high in processed grains and sugars, then what happens is there are spikes or sustained elevations in glucose. Elevated glucose causes damage. And part of my hypothesis here is elevated glucose damages everything. It also damages the endothelium that's lining all of our arteries. As that endothelium is damaged, it has to get repaired. And that's one meal or one snack. And then the next snack, more damage, more repair, more damage, more repair. So all of a sudden, these elastic arteries that are able to swell and bulge and pass blood easily because of their elasticity are now becoming hardened and stiff because of the damage done from elevated glucose. There's a one cell lining called the endothelium. And what that does is that protects the blood from getting into the smooth muscle of the artery. And it also protects the artery from the contents of the blood and so forth. It's a barrier. Once that barrier is broken, the repair process takes place. So your body is inflamed when your endothelium gets damaged. That inflammation, by the way, causes your kidneys to retain fluid, retain salt, and retain fluid to help with the repair process. And this is where LDL cholesterol plays a role. Uric acid, calcium, all these things may get embedded into the smooth muscle of the artery as the repair process is taking place. But this damage happens over and over again. Snack, lunch, snack, dinner, dessert, breakfast, latte, snack, over and over, day after month after year, and so forth. And so all of this damage leads to stiffened arteries, and these inelastic arteries are no longer able to propel blood down to where the blood needs to go. And so the heart works harder to get the blood down to the periphery. As the heart works harder, this is measured as an increase in blood pressure in the blood pressure cuff. So the standard treatment for this has been in the past that you can see your doctor says, okay, your blood pressure is 130 over 85. Try diet and exercise. We'll give you some pamphlets on the way out of here. Come back in 6 months. If your blood pressure is still elevated, we may have to put you on medicine. Then you come back. Then you get put on a medicine. Let's say it's lisinopril, the starting dose. And then come back a year later. Blood pressure was controlled, and now a year later, now it's elevated again. Now they go up to the higher dose. Next year you come in, now we're going to add hydrochlorothiazide. So now you're on lisinopril and hydrochlorothiazide, the combination drug. Still one pill, whatever, but it's two different drugs. And then you get put on a higher dose of the hydrochlorothiazide, and then maybe add on a third agent. You're adding on medications to keep your blood pressure within range, but you're not fixing anything. You're just controlling the symptoms. The disease process is still going on and is still getting worse and worse. If you were off all your hypertension medication, your blood pressure would be really high at that point. See the point? It's not curing it. And I think what happened in our medical community in the world, and I think everybody's to blame for this. I don't blame any one person. But I think what's happened is with high blood pressure, we develop pills and medicine that helps control the high blood pressure. And so as long as it's blood pressure is under control, move on to the next thing. Bigger, better, sexier things to work on than blood pressure. And I think that was a mistake because I think blood pressure is the keystone. If we understand high blood pressure, hypertension, we can understand a lot of what chronic disease is. All right. So how to reduce your hypertension. To reduce your blood pressure, I've got a list of 6 different things here that you can go through. First, and this is the most important, is avoid processed grains and sugars. And I'll give you an example. You may be thinking right now, oh, I just eat whole grains. So I'm talking about whole grain, white bread, wheat bread, doesn't matter. All processed grains and sugars, you need to cut it out as much as possible. And it's going to be okay. You're not going to crave it. You're not going to miss it. because of what's going to happen in number two. Okay. But what I'm telling you, even if you went to Whole Foods and paid $10 for this non-GMO, gluten-free, organic, whole wheat bread with 7 nuts and seeds hanging off of it, you think that's healthy. It turns to glucose in your bloodstream just as fast, maybe a little bit slower, but it still turns to glucose in your bloodstream just like anything else. You might as well just have a cookie, like made with real butter. It's going to do the same thing. Once you get that kind of mindset that any kind of processed grain is not healthy, anything with sugar, you might think you're getting a healthy smoothie because it's coming from a really healthy smoothie place, paying $7 for this big old smoothie. That's a sugar bomb. And it because everything is broke down so it gets absorbed into your bloodstream like this. Every bit of glucose, every bit of carbohydrate that you consume gets turned into glucose, goes in your bloodstream, and then it's dealt with. Unfortunately, that's the way it is. Now, fat is not like that. Fat, you can easily eat too much, and your body's just not going to absorb it. It just passes right through. And we know this not from clinical trials, but from the fact that you got to go buy extra Charmin at the Target because you were eating too much fat. You know what I'm talking about, okay? You don't need a clinical trial for this. But glucose, 100% of it gets absorbed. All right, so that's number one. Number two is I want you to enjoy red meat. We've always learned all our life that red meat is bad for you. Make sure it's white meat like chicken with the skin pulled off of it and chicken breast and all this kind of stuff. That's made sense at the time, but it makes absolutely no sense now. Now we know red meat, fat, and cholesterol are actually good for you. Whether it's lamb, beef, whole foods such as broccolini, broccoli, okra, fruit. If you want to eat fruit, that's fine. Make sure it's whole fruit, like a whole orange or a whole apple or blueberries or strawberries, not in excess because it does raise your blood glucose levels. But that's number two, whole foods, right? Number three is I want you to have one big, beautiful meal per day. So your goal is to have one big meal a day, no snacks. Now, you're going to work toward that. And I would say I would start off with one big, beautiful meal at dinner and just stuff yourself. And you're like, oh my gosh, that's so delicious, but I'm so full. And see, the next day, you're not going to be hungry for breakfast. So you'll be able to skip breakfast. By lunch, you might be a little bit hungry. And so maybe a snack, something like nuts or a raw carrot or something of that nature may be helpful to get you through to dinner. But eventually what I want you to get to is where you just have that one big, beautiful meal a day. Your liver is taking over all your energy needs, whether it's ketones and glucose throughout the day, throughout the night. So you're not going up and down on this metabolic roller coaster. Okay. Number 4, vigorous exercise 2 times a week. Vigorous exercise. Now, what I'm talking about here, it depends where you're at, right? So if you're diabetic and on a lot of medicines and up there in age, do the best you can do. If it's walk the dog 2 blocks instead of 1 block, start there. Start wherever you can. But if you're over 40, but still healthy, you're not quite hit with the chronic diseases yet, I want you to push yourself in vigorous exercise to where you're covered in sweat 2 times a week. I'm not a big proponent of counting steps. I don't think that's as helpful as if you are to really push it to the limits. Now, obviously, do it to where you feel safe. Don't go over that amount. You know when you feel safe or when you feel like you're crossing over that line. But push yourself. Obviously, avoid the processed grains and sugars first. Once you get your diet right, then you start adding in the exercise. You're going to see wonderful changes. I'll tell you what I did, and this is probably 20 years ago when I was 40, is I didn't want to go to the gym and lift weights. I thought that was boring. So I joined Brazilian Jiu-Jitsu Club. Now, let me back up. I was in Fayetteville, North Carolina, home of Fort Bragg. Okay, so there's the 82nd Airborne, Special Forces. So the guys I'm training with are all 23 snake eaters, and they're wanting to rip my arm off and choke me out each and every day that I went. So there was no choice. I had to give 100% effort. My gi weighs, for Brazilian Jiu-Jitsu, weighs about 10 pounds. It would weigh 20 pounds at the end of the night because it was just soaking wet in sweat. I lost 15 pounds I think it was the first month. I lost a lot of weight. It changed my metabolism right away. Now, I only worked out twice a week because that's all I could do. I'd work out Monday, and then I'm sore Tuesday, sore Wednesday, and I was able to go Thursday, and then I'm sore over the weekend until finally, when I got through, then all of a sudden I could work out 3 or 4 times a week. And the great thing about Brazilian Jiu-Jitsu, besides being 100%, you got to have your mind on your business, but it was mentally challenging as well. And I'm learning a skill that's useful throughout life. So I thought that was a wonderful thing. I know a medical doctor's friend of mine who he does rock climbing. Now, he goes to the indoor gym and he practices. Now, he's in his 50s. And he goes to the indoor gym every night after work and climbs for an hour. And this guy is fit and buff. Like, I've never seen anybody in their 50s like this. This guy's really a stud. And then his family is all into rock climbing as well. And they'll go on trips and go rock climbing in different parks and so forth. It is just a way of life. But it's something interesting, it's fun, and it's a physical activity with a purpose. Right? So I think something like that is important as well. But you got to exercise twice a week minimum. What you want to do is you want your muscle cells, which your muscles act as the largest buffer. It's the largest glucose reservoir that you have. So if you get excess glucose in your system, there's a place to put it. As long as you're doing exercise and you have your muscles built up, right? You don't let your muscles atrophy. Then you've got this great glucose reservoir to where you can store this glucose. All right. Number 5 is avoid seed oils. I'm going to read it off here. Corn oil, canola, sunflower, soybean, safflower. There's a couple others like rice bran or something like that. There's the hateful 8 of seed oils that you need to avoid, right? I'm not going to link it directly to hypertension, but I will tell you that consumption of seed oils is one of the most disastrous things to happen to the American diet in years. And number 6 is limit alcohol consumption. I'm not going to say avoid because I like a little alcohol consumption myself, but it needs to be limited. Alcohol is toxic at all levels. Glucose is toxic at elevated levels. Right? So any alcohol consumption distracts your liver from doing what it needs to do, providing energy, ketones and glucose and gluconeogenesis and all this kind of stuff. So if you avoid alcohol, that's great. Alcohol consumption affects your sleep. And sleep is also very important. Man, that should be number 7. I should put that on there. Anyway, I didn't do that. So we'll just stick with number 6. But if there was a 7, it would be sleep. All right, so let me summarize here. So while you reduce your risk of hypertension, you are also going to lose weight. You're going to reduce your risk of cardiovascular disease, chronic kidney disease, heart failure, type 2 diabetes, Alzheimer's, everything from gingivitis to toenail fungus, all the chronic diseases that are associated with elevated hypertension and elevated blood sugar. Yep, they're all related. Now, LDL cholesterol, I know they get a bad rap and it's something a lot of people worry about, but LDL cholesterol is hardly mentioned here. It's part of the repair process to repair the arteries, and that can lead to LDL being trapped inside the smooth muscle, becomes a foam cell, and can lead to a heart attack. But LDL cholesterol on itself has virtually nothing to do with the progenesis of hypertension. Elevated glucose in the blood glycates to the endothelium, causing damage. This damage repeats over and over again, meal after meal, snack after snack, day after day, year after year. Arteries that used to be elastic and viable are now hardened and stiffened, and the heart has to do the extra work, and this leads to hypertension and high blood pressure. So there it is, folks. I just solved one of the biggest mysteries in the medical community for over the last 50, 60 years. I'm not even a doctor. Am I still eligible for the Nobel Peace Prize for this? Now I'll fly to, where is it, Sweden or Denmark, Amsterdam? I don't even know where it is, but I'll go there. I'm not going to book my flight yet. I need to be nominated first, but I think solving hypertension is one of the big things that we can do to help reduce chronic disease among Americans. Over 50% of Americans have hypertension, so this is a huge issue, and we need to get it right. All right, so the next video, we're going to discuss the true cause of atrial fibrillation. And spoiler alert, it's going to be very similar to what causes hypertension. If you like this content, go ahead and like it, subscribe, and we'll see you on the next video. Thanks.